Ladies and gentlemen, welcome to my channel. This is part of a series that I'm doing talking about pre-nursing preparation. In the first video, I talked about anatomy and physiology, gen ed courses, and managing your time. In the second one, I talked briefly about nursing math and the basic requirements for safe medication administration. Lastly, in this one, I'd like to talk to you about just 3 things that are usually pretty similar in most nursing programs. Once you've received an acceptance or soon to be accepted in a nursing program, you might be asked for certain things. One is a background check. A lot of nursing schools are now doing a background check, and that background check will bring up a lot of things. Find out if you're clear, if you've had any history of in the criminal system. I'm not an attorney, so I'm not going to speak on those specifics. Just understand that a background check is used to determine that you are who you say you are and you're of legal whatever. Second, residency or documentation status. Now, this may vary by different states and different schools. However, most state boards of nursing will ask you some type of question regarding that. Are you a foreign student? Are you a citizen? Or are you a resident alien? Again, so remember, that's also one thing that must be considered. So most schools have some type of area or office that will help students, one, with those types of questions. For international students, most schools, colleges have some type of support there and guidance for them as well. And the third thing I want to talk about is health clearance. You will be asked to go to a provider, be a physician, a nurse practitioner, first med, whoever's there, a physician's assistant. And again, I use this term just to remind you of the members of the team. It's a lot of us in the team, and they're all valuable. So you may be asked to go to your healthcare provider to provide a physical. Now, the nurse educator doesn't get the physical because we don't really want to know everything about you, but we will get some type of clearance either from your provider or from health service that says you're clear to care for patients in the hospital, you're up to date on your vaccinations, etc. So again, those are the other three things. A background check may be required, some type of statement or proof, evidence of your documentation, residency status, however term you want to use, and lastly, a health clearance. But just one other thing that I'll add, you will be asked to take BLS, basic life support for healthcare providers, and CPR, as people call them in common, but it's a basic life support for healthcare providers, including the use of an AED. All right, so again, welcome to my channel. I hope this video helps. If you feel it has, please make a comment below. Perhaps somebody else viewing can, give you some insight into stuff that I may have missed. If this is your first time, welcome again, and I hope you stay. Bye.